Speaker, tēnā koe te minita. My question is to the Associate Minister of Health and asks, what advice has she received about the cost to New Zealand of rheumatic fever, for which New Zealand has rates 14 times the OECD average?
The Honourable Tariana Turia.
Rangatira, tēnā koe. The Ministry of Health has advised that rheumatic fever hospitalisation costs are approximately $10 million per annum, and the Ministry is co-funding an economic analysis of cost-effective strategies for managing rheumatic fever, and those results are expected in October 2010.
Supplementary.
Kevin Hague.
Does she regard her government's plan for dealing with rheumatic fever, as outlined by Minister Ryle in this House on the 16th of June, as adequate? And if not, what has been added to the plan since then, especially as there is no immunisation program for rheumatic fever when immunisation was a crucial part of the plan Mr Ryle outlined?
The Honourable Tariana Turia.
Mr Speaker, my understanding is that the streptococci infection which causes rheumatic fever has a number of strains, and this is the reason why a vaccination program has in fact not taken place in New Zealand at this time.
Kevin Hague.
Point of order, Mr Speaker.
Point of order, Kevin
I asked whether she regarded the government's plan as adequate, and if it was not, what had been added to the program since then? I don't believe the answer addresses that question.
Well, order, but I seem to recollect the member including in his question something about vaccination programs. Specifically, I seem to recollect him including that in his question, and that's what the piece the Minister did answer. Supplementary question, Kevin Hague.
Thank you, Mr Speaker. What does her government intend to do to address overcrowding and poverty, the main contributing factors to this disease?
The Honourable Tariana Turia.
Mr Speaker, the Ministry of Health is already beginning to work across the range of government agencies because we do know that health alone cannot address these significant issues that impact on these families who have children with rheumatic fever.
Supplementary question, the Honourable Ruth Dyson.
How will the increase in GST, which will put further pressure on family budgets, and the significant cut in the public health budget, both measures supported by the Associate Minister's party in the budget this year, how will those initiatives help address issues such as our rheumatic fever rates?
The Honourable Tariana Turia.
Mr Speaker, the Ministry program is comprehensive and seeks to address the determinants and boost primary prevention and secondary treatment, which are both important planks in managing rheumatic fever. And the Ministry's program includes providing leadership across the health and rheumatic fever sector, looking for evidence and accountability, looking at prevention by collaborating across government agencies and local government to address determinants, and communicating and working with communities and health professionals to improve health literacy and recognition of rheumatic fever. And they are rolling out checking throats, making it important in all of those areas where we have high incidence of rheumatic fever. Those things are being carried out.
Question number, point of order, Kevin Hague.
Mr Speaker, I seek leave to table a document entitled Why We Still Need to Think of Rheumatic Fever. It's published by the Best Practice Journal in May 2008 and sets out the problems with rheumatic fever and some successful approaches.
Leave is sought to table that document. Is there any objection? There is no objection. Question number 12.